So after analyzing what is going on with me, with my blood work, how are we going to approach going forward? Am I changing my diet? Am I going to take supplements? Or are you providing, prescribing new medications?
That's a great question. When it comes to treatment of chronic kidney disease, I believe that there are two arms for treatment. One of them is the medication arm, and then the other side is the dietary and plus or minus supplements plus exercise kind of arm. I think they both are very, very important when it comes to chronic kidney disease management. When it comes to medications, there are like several different classes of medications that have been shown to help with reducing the progression in chronic kidney disease. Definitely each patient is very different, and it depends on your exact cause of chronic kidney disease. But in general, patients who have chronic kidney disease, who may or may not have protein in the urine or who have some hypertension, a lot of these patients do benefit from a class of medications called ACE inhibitors or angiotensin receptor blockers. And these medications have been shown to help with reducing the progression of chronic kidney disease while maintaining the blood pressure under control. The one thing with that class of medications is that those medications may have to be adjusted depending on your potassium level. So we go back to the lab work, how checking your lab work regularly and making sure that your electrolytes look stable do affect the way that you get treated. If your potassium level, for example, is elevated, then it's going to be more difficult for us to increase certain medications because those medications also raise potassium, like the ACE inhibitors and the angiotensin receptor blockers. So that's one class of medications. For patients who have other types of kidney disease, especially those who have protein in the urine, this has not been studied in polycystic kidney disease yet, but the medication is called SGLT2 inhibitors, and these medications also help with reducing the progression of chronic kidney disease as well. Mainly has been used in patients who have a history of diabetes, but has been expanded to non-diabetic kidney disease. However, polycystic kidney disease has not been approved for that medication yet. Those are the two main classes of medications. For diabetic kidney disease patients, there's also an injectable medication and an oral one. They're called GLP agonists, and they also help with reducing the progression of chronic kidney disease. So that's the medication arm. When it comes to the non-medication arm, that kind of includes the diet interventions. There has been increasing evidence about more of a plant-based diet in chronic kidney disease. A lot of flesh and animal products, those do stress the kidneys out more, and that produces a higher acid level within the body. So reducing the consumption of animal protein and swapping it for more plant-based proteins and a plant-based diet can help with reducing the buildup of these acids within the body, and that can hopefully help with slowing down chronic kidney disease as well. Definitely, when it comes to the exercise recommendations for patients with chronic kidney disease, we do recommend at least 3 to 4 times a week, about 20 to 30 minutes of a moderate physical activity, depending on what your body can handle. This includes light jogging, walking, stretching, yoga. Those are all really, really beneficial for patients with chronic kidney disease. Patients with chronic kidney disease should avoid certain things too. They should avoid medications like the non-steroidal anti-inflammatory medications. Those can affect the blood vessels around the kidney and increase the risk of having progression of kidney disease. Also, when it comes to supplement use, a lot of the supplements that we see online or at a health food store, unfortunately, they have not been tested in patients with chronic kidney disease. So we don't really know what's in those supplements and how it might harm you. So I've been telling my patients to not use supplements. Less is more. And there are certain vitamins that, as a nephrologist, I will give to my patients. For example, vitamin D if they need it, vitamin B12, folate if they need it, iron supplementation. But these are more regulated supplements that we work together with the patient. We check your labs frequently to make sure that these supplements also are doing their job and not causing things to go awry. So I would just discuss supplements with your nephrologist Specifically, I tend to recommend to avoid protein powders like creatine supplements, because that can cause that creatinine level that we talked about can get elevated from that. So we tend to avoid those medications.
Thank you so much, Dr. Priya, for joining us. This is a wonderful conversation.
Thank you so much again, Nercy, for having me. I just want to re-emphasize that these 10 questions that we've been talking about and having a conversation about are really important initial steps for you to improve your communication with your doctor. I know when you go into the doctor's office, it's really nerve-wracking, it's really overwhelming, especially when there is chronic kidney disease. And these questions at least provide a bit of a guidance for you to start having a conversation with your doctor, to know what to ask, when to ask them. I would suggest writing these questions down, or maybe even taking a picture of the questions that are provided on the website, so you can start the conversation with your doctor. I also want to highlight that Nercy and I did a podcast about polycystic kidney disease and topics that are important to polycystic kidney disease patients, so please check them out.
Yes, and also we have a series of 12 videos, light stretching and workouts, 12 minutes each. And you can do 1 or 2 or 3, depending how much you want to do. The whole idea is to keep moving your body and staying healthy. Thank you, Dr. Priya, for joining us.
Thank you.
And let's continue this conversation and having these interactions between doctors and patients so our communication can improve.
Absolutely, thank you.
My pleasure.